When you think about nutritious foods, what comes to mind? It's probably eggs for many. They are renowned for having a lot of minerals and protein. However, did you realize that eating them incorrectly might be dangerous? For more than 60 years, I, Dr. Robert Peterson, have specialized in internal medicine. This year, at the age of 92, I continue to treat patients every Tuesday at a retirement home in upstate New York. I'm frequently asked how I manage to work at my age. Are you curious about my secret? Unbelievably, eggs are one of my health secrets. However, I don't eat them in any old way. I have a certain manner of eating them. I'm going to tell you a significant egg consumption tale today that I discovered while caring for thousands of senior citizens. You probably have eggs on your table every day, don't you? Despite your best efforts, are you maybe eating them in a way that is more detrimental than beneficial? I hope you learned something from this story. To see the entire scene, please watch through to the conclusion. Please hit the like and subscribe buttons while you're at it to keep getting more health-related updates. And I want to know whether you're with me if you're now watching. If this video resonates with you, type 1 in the comments section. If not, type 0. Every year, hundreds of senior citizens visit my office. Even though many of them consume eggs on a daily basis, their health continues to deteriorate. Mr. John Smith, an 83-year-old Chicago resident, is a perfect example. After consuming soft-boiled eggs every morning, he developed salmonella poisoning and was admitted to the hospital. We initially believed it to be a straightforward infection. However, after asking more questions, we discovered that Mr. Smith had been consuming soft-boiled eggs every morning for the last 40 years. He had even been consuming spoiled eggs lately. Age had impaired his immune system, turning a once harmless habit into a serious risk. As we age, our bodies undergo changes. When you get older, eating behaviors that were healthy when you were younger can become harmful. Specifically, eggs are far more complicated than we realize. They have a variety of ingredients, including as minerals, fat, and protein. Additionally, as we age, these elements' interactions with our bodies alter. Over the course of my more than 60 years as a doctor, I have discovered that although eggs are unquestionably a nutritious food, how you eat them can make them either poison or medicine. As people age, this discrepancy becomes much more noticeable. Do you feel as though your health is deteriorating rather than improving despite eating eggs every day? If so, today's narrative will be very beneficial. Allow me to share the tale of Mrs. Mary Johnson, a Kansas woman who is 86 years old. For more than 2 decades, she had been taking cholesterol medicine. Her cholesterol readings never decreased, even though she consumed fried eggs every morning to receive her protein. She was already taking 2 cholesterol meds and 3 heart drugs when she first came to see me. She pleaded for my assistance since she was worn out from her drug use. When I questioned her about her eating habits, she told me that she ate fried eggs every morning for her health, and that she only ate the egg whites at lunch while taking her medication. I will describe the egg-eating technique I taught her below. She did it consistently for 3 months and was allowed to take her cholesterol medicine. During a recent test, her numbers had decreased by over 30%. Additionally, 6 months later, she reported feeling less exhausted and having more energy. She noticed such a shift simply by altering the way she consumed eggs. Isn't that incredible? You are undoubtedly aware of how difficult it is to alter your eating habits, but our 60 years of experience have shown us that even minor adjustments may make a significant difference. Changing your medicine or having significant surgery might not be as effective as what I'm going to tell you today. I'm going to give you some crucial, practical information that can affect your health for the rest of your life. Please watch this video through to the finish to fully understand its importance. Please hit the like and subscribe buttons while viewing this video. More individuals will be able to hear this important information as a result. You could give someone else a healthy 100-year life with only one click. Please be aware that you could endanger your health if you do not fully comprehend this information and apply it improperly. Before putting it into practice, make sure you view the entire video. It's time to consume eggs the proper manner if you have been consuming them for your health up to this point. Hashtags. This is where the important portion starts. Here are 5 ways to eat eggs that you should never do. Eating solely egg whites on an empty stomach is the first step. To avoid cholesterol, many people just eat the egg white and discard the yolk. However, this is a grave error. A substance found in egg whites called avidin prevents vitamin B7, usually referred to as biotin, from being absorbed. Fatigue, sadness, and nerve damage can result from a deficiency in biotin. A vitamin that is particularly crucial in old age is biotin. It is crucial for the maintenance of cognitive function, skin health, and nervous system health. Simple exhaustion may be the initial symptom of this vitamin deficiency, but it can progressively worsen into numb hands and feet, muscle weakness, memory loss, and even melancholy. Because of this practice, Mrs. Eleanor Thompson of Maine experienced extreme numbness in her hands and feet, making it difficult for her to walk. On an empty stomach, this effect is considerably more pronounced. The reason behind this is that when the stomach is empty, there is a lot of stomach acid, which intensifies avidin's action. Even more significant is the fact that egg yolks contain lecithin, omega-3 fatty acids, lutein, zeaxanthin, and other nutrients that are critical for older adults' health in addition to cholesterol. Age-related macular degeneration can be avoided with the help of lutein and zeaxanthin, whereas lecithin is essential for brain function. If you discard the yolk, you lose out on all these advantages. It's an easy practice tip. Make sure to consume the white and yolk simultaneously and not on an empty stomach, but during or after a meal. The biotin content of egg yolks counteracts the avidin action of egg whites. Additionally, consuming a simple vegetable salad or whole grain bread before to consuming the eggs aids in nutrient absorption and slows down the rate of digestion. You should consume 5 to 7 eggs each week if cholesterol is a concern. Most seniors can safely eat 1 egg every day. Consult your doctor before taking any cholesterol-lowering medications, and try to eat eggs in the afternoon if you can. Patients with Parkinson's disease and dementia should use extra caution. This is because a lack of biotin might exacerbate their symptoms more rapidly, especially when their neurological systems are already compromised. Particular caution should be taken by those who are taking environmental hormones or specific antibiotics, as they are also more vulnerable to biotin deficiency. So far, how have you been consuming your eggs? For your health, have you been consuming exclusively egg whites? Eating raw eggs comes in second. Some older folks have a propensity of eating soft-boiled eggs or drinking them with vodka. But the chance of contracting salmonella is extremely high. Additionally, as people age, their immune systems decrease, leaving them more vulnerable to infection than they were in their early years. A simple stomach ache is not the end of a salmonella infection. In older people, it can result in sepsis and severe dehydration fever. Sepsis is a potentially fatal illness that needs to be treated in a hospital. The Centers for Disease Control reports that persons 65 years of age and older are the most likely to die from salmonella infections. Another issue is that uncooked eggs hinder the absorption of vitamin B. Without heat treatment, the avidin in raw egg whites retains 100% of its action. Biotin deficiency may worsen as a result. Additionally, the proteins in raw eggs attach to good bacteria in the intestines, upsetting the delicate microbial equilibrium. Older adults' immunity and mental health greatly depend on the balance of gut microbes. According to recent research, depression, Parkinson's disease, and Alzheimer's disease are all associated with the balance of gut microbes. Mr. Mark Thompson, 82, had a long-standing habit of consuming raw eggs with vodka, which led to his hospitalization in the intensive care unit with severe sepsis. He required a lengthy course of antibiotic therapy even after he recovered, which led to chronic diarrhea, malnourishment, and a disruption in the balance of gut microbes. Eggs must be cooked to 165 degrees Fahrenheit or 74 degrees Celsius or higher to ensure they are safe to eat. Cooking until the egg yolk is fully set is the ideal method. When it comes to boiled eggs, make sure the middle is absolutely hard by boiling them for at least 9 to 12 minutes. Make sure the eggs are fresh before purchasing them. Steer clear of eggs with shell stains or cracks. Refrigerate after purchasing and consume within 2 weeks, if at all feasible. After handling the shell, make sure to rinse your hands. Keep an eye out for things that are on sale or eggs that are getting close to expiration. Putting your health at risk for a deal is not worth it. It's prudent to spend money on fresh eggs for your health, even though it's important to be economical. Do you like raw eggs or soft-boiled eggs? What if we started breaking that habit today? Third, taking medicine while taking it. Many older adults take different kinds of drugs. On the other hand, some drugs should not be taken with eggs. Specifically, eggs can interact with blood thinners such iron supplements and warfarin antibiotics. Warfarin and other blood thinners are medications that stop blood clots. Egg yolks are high in vitamin K, and the amount of vitamin K affects how this medication works. Consuming more or less eggs can abruptly alter the medication's effects and raise the danger of blood clots or bleeding. Antibiotics that bind to calcium, magnesium, and iron in eggs, like tetracycline and quinolone, can decrease absorption. This may lessen the medication's effectiveness and cause the infection to take longer to cure. When iron supplements are taken with eggs, iron absorption may be hampered. This is because iron and the protein in egg whites combine to generate a compound that the intestines cannot absorb. For elderly persons who suffer from anemia, this is a particularly significant concern. After eating blood thinners and eggs, Mr. Harold Smith, 85, was sent to the emergency hospital with a cerebral hemorrhage. This is because warfarin's effects were lessened by the vitamin K in the eggs. Mrs. Dorothy Jones, 76, also suffered since, despite taking iron supplements and eggs, her anemia was not getting better at all. It's advised to wait at least 2 hours between taking medication and eating an egg for safety. Allowing up to 4 hours between doses is much safer if you're taking particularly vital meds. Additionally, be sure to discuss any potential interactions between eggs and your medications with your doctor or pharmacist. Every medication has particular safety measures. In theory, thyroid drugs like levothyroxine should be taken in the morning without food. However, it's better to wait at least an hour after taking the prescription before eating eggs in the morning. Additionally, statin cholesterol and high blood pressure drugs should be taken at least 2 hours apart from eggs. Additionally, if you're taking calcium or zinc supplements, be especially mindful of eggs as they may hinder their absorption. Zinc is vital for immunity, and calcium is crucial for healthy bones. If you take supplements, take them at a different time and avoid taking them with eggs. When taking your prescription, what meals do you typically eat? Consider whether having eggs with your medication is a habit of yours. Fourth, eating from 600 to 800 in the morning. Early in the morning, a lot of individuals eat steamed or fried eggs, but our bodies release the greatest cortisol during this time of day. Cholesterol levels are raised by cortisol alone, and they can rise sharply when paired with eggs. Despite its reputation as a stress hormone, cortisol is a vital hormone that controls the body's daily cycles. Naturally, it secretes more when we wake up in the morning and less when we go to bed. The issue is that cortisol encourages the liver to produce more cholesterol. Cortisol levels are at their maximum during the hours of 600 to 800 a.m. Consuming eggs at this period encourages the liver to produce more cholesterol. Given that older people frequently have poor cholesterol metabolism, this effect may be even more pronounced. After eating fried eggs every morning at 6 in the morning, Mr. Ronald Jones, 78, suffered an abrupt myocardial infarction and passed away. His cholesterol levels were twice normal, according to tests. He ruined his health by eating eggs every morning for health reasons. Another issue is that in the morning, the digestive system is not completely engaged. Protein-rich eggs can be difficult to digest, but the gastrointestinal tract rests all night and then gradually starts to work again. Indigestion, bloating, heartburn, etc. may result from this. Eggs are ideally consumed between 200 hours after sunset and 4 p.m. The synthesis of cholesterol is at its lowest during this time of day. Additionally, vitamin absorption is more effective because the digestive tract is fully engaged. This time of day also sees the highest levels of liver activity, which improves the efficiency of cholesterol metabolism. Additionally, always eat vegetables with eggs. Vegetable fiber lowers the absorption of cholesterol. Eggs pair especially well with vegetables like onions, spinach, and broccoli. Antioxidants safeguard the health of blood vessels, while fiber encourages the intestinal excretion of cholesterol. Avoid eating eggs right before bed as well. It takes a lot of energy to digest proteins, which might disrupt sleep. Additionally, the body heals and regenerates during the night, so it is preferable to concentrate on rest and recuperation rather than using energy for digestion. If you need protein in the morning, choose for items like Greek yogurt or tofu that are simpler to digest than eggs. These are better suited for breakfast because they are higher in protein and less taxing on the digestive system. When do you typically consume eggs? Consider switching the time if you usually eat them first thing in the morning. Fifth, cooking with oil at high temperatures. One cooking technique that many people like is fried eggs. But frying eggs in hot oil can denature the protein, making it harder to digest and irritating the lining of the stomach. The protein in eggs is extremely heat-sensitive. The protein structure is denatured by cooking at temperatures higher than 212 degrees Fahrenheit, which hinders the action of digestive enzymes. This makes digestion more difficult and can be a serious issue, particularly for elderly people whose stomachs are less functional. The toxic compounds produced during high-temperature cooking are a greater issue. Hazardous compounds, including acrolein and aldehydes, are created when oil reaches its smoke point. These chemicals promote inflammation and raise oxidative stress over time, in addition to directly irritating the stomach lining. Choline, a vitamin found in egg yolks, is likewise destroyed by high-temperature frying. Choline helps prevent cognitive decline in the elderly and is crucial for brain health and memory maintenance. Cooking at high temperatures destroys these healthy nutrients, which is a huge loss. Mrs. Jane Smith, 84, had chronic gastritis as a result of consuming fried eggs on a daily basis. She lost weight, and her hunger diminished. But after switching up how she cooked her eggs, her gastrointestinal issues considerably improved. She initially assumed it was just indigestion, but the high-temperature cooked eggs were ultimately the cause. Mr. George Smith, 82, had the same thing. He had always loved fried eggs, but as he grew older, he experienced severe heartburn and found them harder to digest. After switching to boiling as the cooking method, his protein intake improved and his digestive discomfort significantly decreased. Eggs should ideally be boiled in cold water for 10 minutes over low heat. By reducing protein denaturation, this promotes easy digestion and optimal nutrient absorption. Once the water begins to boil, it's critical to lower the heat and boil it over low heat. The protein in eggs may become overly hard if they are constantly boiled over high heat. Steamed or poached eggs, which are cooked gently at low temperatures, are examples of additional cooking techniques. While the latter involves slowly cooking eggs in hot water, the former involves cooking them softly with water. Both techniques reduce protein denaturation and don't utilize oil. Avoid using the microwave to cook eggs in particular. The protein structure is severely denatured by rapid heating, which can occasionally result in an explosion. The uneven heating in the microwave causes some parts to be overheated and others to be undercooked, which makes digestion more challenging. It's also a good idea to cook eggs with herbs or spices. Elderly people benefit from the anti-inflammatory and digestive-promoting properties of herbs like parsley, pepper, and turmeric. Specifically, turmeric's curcumin lowers inflammation and supports brain function. How about switching to boiled eggs starting today if you've been eating fried ones up until now? I've covered 5 egg-eating habits you should avoid as you mature so far. Without a doubt, eggs are a healthy food. They can, however, be detrimental to your health if used improperly. Let me restate. 1. Egg whites alone should not be consumed on an empty stomach. Consume the yolk with a meal. 2. Steer clear of raw eggs. Make sure to cook them all the way through. 3. Avoid eating while taking medicine. Give yourself at least 2 hours. 4. Avoid eating in the morning. The ideal time is from 2 to 4 p.m. 5. Cooking with hot oil is not recommended. The best method is to boil in water. By adhering to these guidelines, eggs will become the ideal food that efficiently provides not only protein, but also a number of other nutrients, including vitamin D, vitamin B, group selenium, and choline. Consuming protein is particularly crucial as one ages. Protein has several functions, including as preserving muscular mass, boosting immunity, and accelerating the healing of wounds. One of the best foods for getting this protein is eggs. I have continuously adhered to these little guidelines, which is why I am still able to practice medicine at the age of 92. It takes time for eating habits to alter, but even if you only implement one of the lessons you learned today, it will add up to a significant shift. Eggs will be a health tonic if you only adhere to these 5 guidelines. Decide on one action you can take now. What if we boiled eggs tomorrow morning and had them for lunch with veggies? I'll discuss 5 things you should eat in your later years in the upcoming video. Similar to today, I'll offer practical health advice supported by scientific data. I appreciate you watching thus far. For a healthy 100 years, remember to like and subscribe. Make wise decisions and put them into effect every day. I hope you live a long